Okay, welcome everyone to our community navigation webinar, a chance to meet local community navigators in the Shoreditch Park and City PCN. Thank you all for coming. Today we are joined by a social prescriber, Sahir Ahmed, a health and wellbeing coach, Shanaz Begum, and a care coordinator, Leanne Stanislaus. So as I mentioned, they're all from our Shoreditch Park and City primary care network. If you don't know what a primary care network is, that is a network of local GPs. So local GP surgeries, it could be between 3 to 9 GP surgeries in each network. And they work around a population of around 30 to 50,000 people and look at addressing local health needs, but also health inequalities. So today we're going to be looking at community navigation. As I mentioned, these are the 3 roles we've got present with us today. So we will be finding out a little bit about who they are, what their backgrounds are, how they support people. They'll have a case study each and also talk about their referral processes. So just to introduce this, what is community navigation? So community navigation is an umbrella term that we use in City and Hackney to describe a variety of roles within local services that provide one-to-one non-medical support that's centered around what matters to you conversations. So really, it's all about listening to individuals, focusing on what matters to them and developing a support plan based on their strengths and wants. So this does also involve connecting a person to a range of support offers in a local area. So here we're zooming in on that Shoreditch Park and City neighbourhood. So there are at least 28 services in City and Hackney that deliver this work. So from Age UK is one example. They've got dementia support workers. You've also got HIV support workers at Positive East. But today we're focusing in on one of our local PCNs and the community navigation roles there. So for any practitioners on this call or listening to the webinar, there is a community navigation guide that's got a list of our local community navigation practitioners, which you can request through the Neighbourhoods team if you go onto our website and get in touch. We are creating a guide for residents as well, but that's still in production. But again, just keep up to date on our website or with our newsletter, and you can get access to that. But without further ado, we will get into the presentations. So first up, we've got Sahir, a local social prescriber.
Thank you so much, Brittany, for the introduction. Hello, everyone. Yep, my name is Sahir, and I am one of the social prescribers for the Shoreditch Park and City PCN. I generally work for an organisation called Family Action, and we've been commissioned to do this work, at least for the next 5 years. And I come from a therapeutic background. So originally I'm a counsellor, a person-centred therapist, and I have a keen interest in isolation, especially male isolation. I used to run a few groups from 2017 to 2020 prior to joining this PCM, and I also run a group now in the Hoxton area for isolated men, anyone over the age of 30, essentially. As well as the men's group itself, I run a walk with my colleague Beverly, who is the other social prescriber in the neighbourhood. And just a bit about myself, I enjoy eating food, going out, spending some time with friends, family, really enjoy the cinema and films, and I play a lot of PlayStation in my spare time. Next slide, please. So essentially, what is social prescribing? What do I do? So I'll break this down to 3 separate parts, really. So it's staying connected with the community, giving people information, advice and signposting, and essentially making referrals to specialist service and accessing additional support. So essentially, we have strong links in your local area. As Brittany already explained, we've got about 28 different services that run these type of support networks. Essentially, what we do is we help re-engage people, getting out there again, learning something new, creating new bonds, local activity groups, exercises, classes, and it could be a wonderful way to get reconnected within your community, make new friends, and combat any feelings of loneliness, isolation, and boredom. All of these things can essentially affect everyone at any stage of their life. So we try and meet people where they are at that point and have general bespoke conversations and bespoke plans to support them with each and individual of these situations. So I'm stumbling my words a little bit there. As well as the connecting with the community, we also offer information advice. Sometimes people have a lot of questions or need advice on how to move forward in a particular situation. And we have a lot of local knowledge and general knowledge of how some situations work. And we're always happy to share everything that we know to help everyone move forward. Now, I always say this to each and every one of my clients that I speak to. I may know a lot of things, but I don't know everything. So for all the questions that we don't have, we may signpost you to an additional organisation or a charity that might be best suited for your to support you. Just as an example, housing. A lot of people have housing issues, and although it is a social issue, we're not social workers. So we would then refer you to an organisation like maybe Hoxton Trust or Riverside Engage, who can more support you around housing matters or benefit forms and stuff like that. So, you know, like the signposting, referrals to specialist services and additional support is a key part in what we do. So there are many community-based and local services that can offer additional support and can help you access even more services to support your needs. And this, on occasion, can be completed by us, but sometimes it could be, we could also need the support of your GP to make a referral somewhere. Now, it's can be complex to kind of explain how that is. So in the session, I would explain to my clients exactly what the process will be if we need to make an additional referral elsewhere. But as well as that, there is talking therapies linked to community centres, exercise classes, volunteering, and at some, you know, on some levels, there are access to grants as well. This could be for various different reasons. And again, we have to approach every situation in its own way. Can I get the next slide, please?
Yep. I am just going to mute myself because I need to got some building work.
So essentially, what does that mean to you, or what does that mean to me, the client? So it will be an opportunity to sit with someone and discuss your current situation, and hopefully formulate a support plan or an action plan to get you from A to B. Now, what we can initially do is just find out about local services, new or existing classes, groups and services that are local to you. And if we can't find them local to you, then we can reach out to different different areas, you could say, but we do our best to keep things integrated within your PCN, within this area, so it's easy for you to connect with and easy for you to get to. So again, a part of that is connecting with support services that may be able to help you in your situation, and also engage in something new, try something different, which may help your overall well-being. A good example of this is someone who may be feeling isolated, may not feel that they know a lot of people or have lost contact to a lot of people for various different reasons. So what we're trying to do is link you into a group or an exercise class or a walking group, for example, and that way you can make some small bonds with people that you can slowly get to know. But these people could be absolutely anyone. As Brittany explained at the beginning, we've got so many clients within the PCN that a lot of people probably be someone on your street that will be joining this group. So it's a really good way to build community links. Another part of this is it's not just a one-stop shop. It's not just one session. We offer people up to 6 sessions. And in that, we offer reviews as well. So check-ins and reviews. It could be once a month, once every 2 weeks. It really depends on someone's need. But we always do this to see what's working, what's not working, and make changes to suit your needs along the way. So essentially, all of the above will be moving towards a happier and healthier lifestyle in a constructive way.
You're muted, Sahir.
Yep, there we go. Can you hear me now? Perfect.
Yes.
Joys of working remotely, everybody. I'm just going to do a short case study of someone that I've supported over the last year. I'm referred to him as Person A. So he was referred to a service to support him around his well-being and feeling overwhelmed with life admin. A little bit of background: he was a carer for his mother for over 10 years. When she passed, he realized that he put his own life and his own needs to the side, and he became overwhelmed with reintegrating back into life, really. So he didn't have a passport, he didn't have any forms of ID, he wasn't linked to any benefits or anything like that. So it's quite overwhelming for someone to be in that situation. So he was socially isolated. He wanted to get back into light exercise, but he was unable to join the gym. And he was interested in meeting new people and essentially getting back out there. So what did we do? So as well as providing practical and emotional support, we use the sessions to talk about his life and reconnect with things that he enjoyed doing. So through those conversations, we was able to find different types of services as well, and find essentially what it is that he would want, opposed to what people think is right for him. And that was quite empowering for him to be able to make that choice. Through that, we made referrals to Age UK, Mind and Adult Social Care, and Engage Riverside. So these organizations, they can actually support you in different ways. So Age UK supported him through his benefits. So they were able to access him the correct benefits and also inform him what he was entitled to. Mind was essentially trying to link him in with some counseling support, some psychological support. Unfortunately, they weren't able to pick him up just due to their caseload, but we were still able to make that referral, and was happy to know that there are organisations out there. Adult social care, again, we're talking about the social care department. They are there to support people in his situation, and that could be mental health, physical mobility issues, or anything like that. Adult social care linked in with our local authority, we're there to support him. And Engage Riverside is an organisation I already mentioned. They are fantastic at supporting people with housing issues and benefit issues, and also form filling. So that was quite important for him at the time, because he didn't understand all the forms that were presented in front of him. As I mentioned about the Get Together men's group that I run and the walking group, we invited him to both of those things. He really integrated well, which I'll kind of explain on the next slide. And as he had some issues around finances and details and ID, we had to issue a food bank voucher a couple of times. And that was just to access an emergency food package, so he didn't go hungry. So essentially the outcome of this is, over these 6 sessions, he was supported by many different services that I mentioned. He was a regular attendee to both the Get Together and the walking group. He did feel more supported and found his tasks more manageable. He felt more motivated, confident, and connected to people. And he's now part of a new group, a community, you could say, which he classes as friends. So overall, he's feeling much more happier, healthier, and in control. And he was happy with the support he was given. So we've got 2 more people on this call with us, which is Leanne and Shanaz. And essentially, we all kind of fall under this social prescribing umbrella. So we do work we can actually work together on some cases, and I'm just going to use this as an example of how that happened. So we're going to refer to this client as Mr. T. He was originally referred to Shanaz, who identified that he may benefit for social engagement. So Shanaz then reached out to me regarding the Get Together men's group, and then what Shanaz actually did, she explained a little bit about the group to him, and she actually brought him down to the group, because he needed a bit of extra support finding where it was. So once he actually attended, we invited him down with open arms, made him feel very comfortable. And he stayed for half of the session, but he did later decide that it wasn't for him, and that was absolutely fine. I think we were all happy with the fact that he tried something new. And what I did then is I fed back Mr. T's attendance to Shanaz and just let her know how it went, and then they followed that up in their session prior to that. So how to contact your social prescriber. Now, a lot of people probably weren't aware that they had a social prescriber or a care coordinator or a health wellbeing coach, but we've actually been embedded in your GP surgeries for a while now. And it really is easy to access us. So the easiest way is a referral by your GP. Now, your GP may mention the service during an appointment, and they can make a referral directly to us. But even if you don't have an appointment with your GP, but you're watching this session right now and you feel that you want to, you can easily call your practice and ask to get booked in with a social prescriber. Everyone's aware of us. It's a really easy way to book yourself in, and everyone will be happy to book you in. So we get utilized very well. We're generally quite busy, and that doesn't mean that you're going to have a long time to wait, but just make a call, get yourself booked in, and then you can end up having a conversation with someone like me. So additional roles such as health and wellbeing coaches, care coordinators, a diabetic nurse, a PCM pharmacist, or a physician's associate, and even reception staff all can make a referral, and if they feel that you could benefit from social prescribing, or if in general you just had more questions and they couldn't answer them, they can always book you in with me, and I'm happy to explain exactly what we do. And just at this present moment, if anyone's got any questions for me, please fire them out. I'll be more than happy to answer them.
Thank you, Sahir. Just have to exit the full screen to see everyone. I don't think we have anything in the chat yet, but I definitely found that really interesting. We in City and Hackney have such a great voluntary sector and a lot of amazing support services available to people, but it can be quite overwhelming for someone to try and navigate them on their own. So knowing that we have people in positions like yours within our GP surgeries to help people get to the support that they need is really great. Yeah, I welcome questions in the chat. We will come back to questions at the end. You might want to process some of the information that we've just heard. And I'm not sure, Sahir, if I get any questions even after the webinar, I'm sure I can come back to you.
Yeah, of course. Any questions? I mean, I think Brittany, you could probably add my contact details in there, and anyone can reach out if they had any questions, if nothing popped up now. And I did forget to mention that you mentioned the volunteer sector. Yes, there are many different volunteer sectors out there. We can get people actually involved with these volunteer sectors. And also, some people may have been out of work for a little while. There's loads of back to work schemes and rebuilding skills and stuff like that. So there's loads of things available, but it all depends on where you're at, and it all depends on what you're comfortable with. So by all means, just reach out. There's no harm in asking the question.
Great, thank you so much, Sahir. Okay, so we'll move on to our next presenter then. Let me just mute myself as I put full screen up again. So we've got Shanaz Begum, our health and wellbeing coach in Shoreditch Park and City.
Hello everyone. Hi. So yeah, hi, my name is Shanaz Begum. So it's hard act to follow after Sahir, but I'm hopefully going to try and explain to you what I do as a health coach and how you may benefit. So first of all, a little bit about myself. So I'm a health coach for health and wellbeing. I'm a health and wellbeing coach, and I work for an organisation called Shoreditch Trust. I work within the GP surgeries in Shoreditch Park and City Neighbourhood. Sometimes I'm, on site, and sometimes I work remotely. So it depends, like with the GP surgeries. However, I try to meet people face to face whenever possible. I've been coaching for over a year now. Previously, I've worked in education, I've worked in childcare, I worked on a project on maternal health and wellbeing. My background is psychology and counselling. I'm currently a trainee psychotherapist. And in addition to the coaching, I also run a walking group in Shoreditch Park, which runs on Mondays between 12 and 1. And I'll talk to you about it a bit more towards the end of my presentation. So, health and wellbeing coaches, the idea is that we work alongside people who need additional support to manage their conditions better and to live the best possible life. So typically, it might be someone who is struggling to adapt their lifestyle to cope with a long-term health condition. So a long-term health condition is an umbrella term for anything that is chronic and enduring, and has a significant impact on your life. However, with coaching, as long as your condition is not acute, that needing emergency care, it's something more general and you're able to just want to learn how to live better with it, then that's really good. That's where coaching can work really well. So it doesn't have to be just a physical, it can be a mental health issue as well. And the idea is that you're not in crisis or you don't have any uncontrolled addictions. Those are a few of the exclusion criteria. But other than that, it's a very open service. So you might have been told that you're at risk of developing a health condition that may be because of a person's lifestyle factors. For example, might be a smoker, might be having issues with alcohol, excessive alcohol, might be physically inactive, might have poor diet, or just have high stress levels. You might be concerned about recent health tests. Your GP might have told you need to lose weight, you've got high BMI, or you've got, come back with sugar in your blood or high blood pressure. And then sort of you're really concerned of, okay, how do I stop this happening? How do I stop getting this becoming more serious? So it's currently open. It's a free service to anyone who's registered within the City and Hackney GPs, and it's to people over the age of 18. However, that's something that we're hoping to expand to the under 18s as well in the near future. Another typical, so people who are wanting help with weight management. So not necessarily I'm going to help you go to the gym, but certainly might be to how to access services to improve your physical health, how to maybe do things with outside of the gym that can improve your physical activity levels as well. Next slide, please. Right, so coaching support takes into account the wider issues that might be having a negative impact on your health. So it's about taking a holistic approach. What are the things that are going well for you? What are the things that are not going well for you? So it might mean supporting people to access other support, for example, welfare-related housing, or to look at social isolation. So I'm not a specialist in housing or benefits. However, part of my job is to refer and signpost you on to more suitable organisations that might be able to help you with those sorts of things. So to support people, what I do is I help you to set goals to increase your knowledge and skills and confidence, to help you to take an active role in your health and well-being, and engage with community activities and community resources that are out there, help you to get better informed, find advice and guidance on practical day-to-day issues, and meet people who have similar experiences so that you can get peer support. So peer support is one of those things that can help to tackle social isolation, because long-term health conditions can typically mean that you lock yourself away, you feel very alone. So by accessing things in the community, you might meet people who have similar experiences to you. So therefore you're able to start talking and giving and receiving support, and that's very empowering and helps you to take a more positive attitude in your life and help you to move forward in living better with your condition. So when someone is referred to me, so you will have an initial 1 hour assessment session. So that's where I really try to take an in-depth, holistic look at your life, what's going well for you, what's not going well for you, what are the good things in your life, what can be improved, what are your support systems like. After that, you'll have an average of 8 sessions that are one-to-one, lasting for about 30 minutes. These can be face-to-face, they can be over the telephone, they can be video calls, and I try to meet people as much as possible. So it might not be that we meet in the surgery, but I like to meet people out in the community. So I love to meet people outdoors, for example, parks, leisure centres, cafes, libraries. I can be really flexible in coming out to meet you in places where you're comfortable. The only place that I don't go to is your own home. However, I can meet you at your doorstep and we can go for a walk and talk about and have sessions like that. I call them walk and talks, which are really popular. So clients are supported to set meaningful goals around their health and well-being. These are, and I'll come to those in a little bit, about what that means. Also means negotiating barriers. So looking at what are the barriers to you making positive changes, and look at what you can do about them. So, and accessing activities and support services, and yeah, the idea is that you are in charge of your wellbeing journey. It's not about me telling you what to do. It's about you saying, Shanaz, this is what I want to do. And then us sort of working together to help you to get to that ideal place. Next slide, please. So I talked about goals before. I support you to make SMART goals. So SMART goals are basically, it's an acronym, so it's specific, meaningful, action-orientated, realistic, and timely. So when we look at your health and well-being and you want to set goals for yourself, they have to be specific. So what is that you want to achieve? What is your area of focus? And they have to be meaningful, so it has to be something that is important to you. And this is the bit where I'm not prescriptive. I'm not going to tell you need to do this. I'm sure you have lots of people telling you need to do X, Y, and Z. But if you don't think you have the capacity or the capability, or you don't want to necessarily, then that's not going to be meaningful to you. So it's about what is meaningful to you. And then looking at the nitty-gritty of it, what little steps can you do to start you off, and then hopefully build upon as time goes on. And they have to be realistic. So it goes on to, the little steps and then building on. So the idea is that you're slowly improving your confidence, and timely. So you give yourself a time limit for your goals, and then once you achieve it, and then you move on and you take a step up. So that's what SMART goals are in relation to health coaching. Also another So also another thing to mention about SMART goals is that goals are related to your values. Now, values are a set of ideas which are important to us as individuals in the context of our lives. So by identifying your values, you're able to identify behaviors which are consistent with them, and by setting goals which are consistent to your values, there's something happening with my tongue there, you're able to work towards changing behaviors that are consistent, and hopefully minimizing behaviors that are not consistent with your values. For example, a value might be, I want to live my life healthy. So living a healthy life is a value. So then what are the things that you can do to help you to live that life, live according to that value? And what can you do that you're doing that's getting in the way of it, and maybe look at ways of reducing those behaviors. The point is, values are based on what's important to you. There's no right and wrong. It's about doing what truly matters to you and what gives your life purpose. So next slide, please. So this is a case study. So this is a very brief example for looking, which might be useful in thinking about the types of people that I work with. So Em has been living with diabetes for many years, and she was ambivalent about taking medication regularly and was struggling to build a routine to support her health and well-being. She wasn't being as active as she would have liked to have been. She wasn't necessarily eating the right things, and as well, not taking her medication properly. And so there's quite concern about her diabetes not being in control. So after a chat, she decided to set goals around managing her medication and becoming more physically active. So her actions were, to help her with that, was to include keeping a physical activity diary, to get an accurate view of her current activity, and start to plan some small changes that she can do to get her more active, and to hopefully start an exercise routine. Part of that was to include a referral to Healthwise Hackney for the supported exercise service called Adult Weight Management. Also, she made a decision that she was going to talk to her health professional about her medication to get a more in-depth understanding of what medication she's actually taking, why she needs to take it, how she needs to take it. So helping her to take ownership of her medication and her care in that sense, and just being more open and honest with the professionals involved in her care. She also felt that inappropriate housing was having a major impact on her health and well-being, and so she was supported to make a referral to a housing support worker to help with bidding for a more suitable accommodation. So in this way, Em felt like, yes, the background stuff regarding her housing was being addressed, but also she was able to start making those small changes to get her started on living life better with her diabetes. So how to get in touch with me? So like I said before, this is a free service open to anyone over the age of 18 with the GP in City and Hackney. You can refer yourself via your GP or any healthcare professional within the GP surgeries or even in, you know, the wider healthcare professionals, as long as they've got links to your GP. If you're not, you can also self-refer. So there's an email address at the bottom. There's also a phone number that you can contact. If you're not sure if this service is right for you, you can just request a call back by calling that number or that email, and I will call you back and I will discuss the service with you, and then you can make a decision as to whether or not it's the right thing for you. So your GP might even say, or your nurse or whoever might say, health coaching is something that might help you. So, and you might not necessarily know. So when I talk to you, I will explain to you what it is and how it might benefit you. And then the choice is up to you whether or not you want to do this. So here are some service user quotes of people that I've worked with. The bottom one, which is, you know, I'm a very socially anxious person. Shanaz supported me to attend the Shoreditch Park Health Walk. By doing the walking group, I've made a few friends and I look forward to meeting them every week. So this is, you know, a testament to the walking groups and how they can really help people to combat social isolation, people who have anxiety around meeting people, and just by encouraging people to turn up at a place every week on a regular basis, they're able to make a routine in their life and they're able to plan things. It gives people things to do, and at the end of the day, people make social links and start to feel better. And the walk itself runs every Monday, 12 o'clock. We meet in front of Britannia Leisure Centre in the stone seating area. You don't need to be booked in, you just turn up, try to turn up a little bit before 12 so that I can meet you and register you. But other than that, yeah, you know, and with my walk, we're not solely staying in Shoreditch Park. Sometimes we branch out to the neighbouring green spaces as well and take in the canal as well. And so I try to make it varied, so keep it interesting. Yeah, that's my walk. Yeah, that's it. So if there's any questions for me, please ask away.
Thank you, Shanaz. Again, a really useful presentation. I think part of the demand for this webinar actually came from people wanting to understand how to differentiate some of the community navigation roles, and already now seeing 2 presentations, it's really interesting seeing that you tend to focus on clients who maybe have those like long-term health conditions or are at risk of them, but you do focus on both physical health and mental health.
Yeah. Oh, definitely. So it's very much my role is about health and well-being. However, saying that, you know, as Sahir mentioned before, we do a lot of cross referrals between us in the well-being team. So quite a few people, if I feel that they would benefit from social prescribing, I'll refer on to him, and same with Leanne, and they do the same to me. So it's really about working together for what's best for the client, really.
That's great. There's flexibility in the system if someone's asked for one service but maybe suits
Absolutely. Yeah. I mean, there's been cases where I've worked with people for a set number of times, and then now they're ready to move on to social prescribing. You know, we've worked on the anxiety, we've worked on the health, and they're in a much better place physically and mentally to sort of engage in the social side of things. And so that's where social prescribing comes on. That's quite often the case for me.
Great. Thank you, Shanaz. I haven't got anything in the chat yet, and we're looking on time, which is great. We're going to schedule, so I'll move on now to Leanne for our final presentation. Leanne, our care coordinator, you can take it away.
Hi, I'm Leanne. I'm the care coordinator. So I'm employed by the Shoreditch Park and City PCN. So a bit about me is I've been a care coordinator for the Shoreditch Park and City PCN since last August. I have an honours degree in criminology and criminal justice system, and I have previous experience in the mental health background. So what I do is I work in primary care. I'm a part of a multidisciplinary team. I provide assistance to those in need of proactive support. So anyone identified by the GPs or GP service for needing extra support, they'll usually go on to refer them to me. I work with individuals to build trusted relationships, finding out what matters to them by creating a personalised support care plan, which I will show in the next couple of slides. I usually work with them by by following up consultations and discussing what they want to, any concerns that they want to discuss with any healthcare professionals. I proactively identify and cohort to work with people to manage their needs, ensuring that their queries and supports are dealt with. We could work on a range of issues such as managing their health, managing their needs, answering their queries and supporting them with their appointments. I also support with training and employment and access appropriate referrals where eligible, and ensure that they have a good quality information to help them make better choices about their care. Next slide. So here's an example of a personalised care and support plan which we'll go through. So usually once they have been identified as needing care and coordinating support, this is something that I would go through with them in their first initial appointment. If you want to go to the next slides. So it's broken up of different sections. So first of all, we would first identify the things that are important to them and what type of benefits they want to receive from accessing care coordinating support. We'll then go on to identify all the organisations that would need to be involved and would work on a time frame and a time limit of what support they wanted to, issues they wanted to deal with first. So unlike the other two, Shanaz and Sahir, we won't have, there'll be an unlimited amount of sessions that we'll have, and we'll work on a range of issues. It's not directly one support issue or need that they want. Yeah, we work on a range of issues. Next slide. Yeah, so this is just the cares plan. Next slide. So who will benefit most from care coordinating support? So here's a list of any individuals that you may identify. So usually patients on the learning difficulty register, non-attenders, elderly and frail, and in patients with multiple health conditions. Next slide. So typically a care coordinated support will look like this. So first of all, you would go to your GP and discuss any concerns. And if your GP does identify that you need care coordinated support, they'll usually get you booked in either via either via EMIS or by a direct booking in my clinics, which I will then show you the timetable to, so you know what days I'm working at your specific GP practice. We'll work together by creating a care plan, which was shown previously, and identify any support needs. And then once I then identify all the support needs, we'll work together for a range of sessions until you feel like you don't need any care coordinator support. Next slide. So you can be booked in through the care coordinator by either a direct booking by yourself. So you can call your GP service and they discuss any concerns and they can get you booked in, or you can mention it to your GP and they can book you into my clinic via EMIS or on the days that I'm working at the specific clinic. And next slide. So here's an example of a case study of someone who I've worked with. So Mark is an elderly male patient who has a range of long-term health conditions that he has to regularly attend hospital appointments for. Mark has poor mobility and finds it difficult to attend his appointments. So some of the actions that me and Mark worked with was we create his personalised care plan first. I arranged transport for Mark to attend his appointments, and I completed a dial-a-ride form so that Mark can access different amenities in the community. And I also made a referral to Age UK. So some of the outcomes that Mark found from having care coordinator support was Mark felt more confident. He stated that he no longer feels isolated as he's now able to transport within the community and attend his appointments and complete any tasks that he needs to. And Mark doesn't feel as restricted to his home, and he feels that he's independent and free to do complete all his needs. Next slide. So here's a timetable for the days that I'm working at the different clinics. Monday's still yet to be confirmed. But yeah, sorry, that was a bit rushed. But if there's any questions, please feel free. I will leave my contact details in the chat. Yeah.
Thank you, Leanne. Again, a really useful presentation to differentiate your roles, but also see how you work together. So from that presentation, am I right in saying then, as a care coordinator, you'd probably be more likely to work with someone who's got a range of issues or needs, or is already interacting with multiple services and needs a bit of support just managing all of those needs. I suppose it is in the title with that one, isn't it? Care coordinator. Okay, great. And again, it looks like you've had a really great impact in terms of improving residents' confidence and just linking them up better with the offers in our local area. So thank you, Leanne. Is there any questions from participants in the room about anything we've heard today? Feel free to unmute or drop it in the chat.
Hi, I just wonder, Miss Leanne and Shanaz, are they just one person working in the Shoreditch area? I know there's lots of social prescribing, different people in the area, I think. I'm not sure. But it's just the one person.
Yeah, yes, we are just the one person. However, we do contact everybody. So is there anything specific is there anything you're concerned about at this point?
No, I just wonder, I mean, because we give you details for the contact details. I just wonder if you are just one person working in this role, or there are other people as well. Thank you very much. It was really nice information.
Thank you. With regards to the health coaching, so there's a health coach for every neighbourhood in Hackney. So you know, one health coach covers the whole of their neighbourhood. So yeah, but I cover all the surgeries in Hackney. Sorry, in Shoreditch Park City. Thank you.
Yeah, thank you very much.
Yeah, I'll definitely agree with you that the name social prescriber pops up a lot, and there are a lot of them in different services. But essentially, we're all here working together to make sure everyone is supported in the best way. So even if we have different names or it's a different service, we're all working towards the same goal. So I just wanted to add that.
Yeah, thank you very much.
Thanks, Ison. And I suppose a follow on from that, obviously, if there is only one health and wellbeing coach and one care coordinator, do you guys have much of a waiting list, or have you got room for new people?
For myself, not really, no. I mean, I'm not busy, but I endeavour to contact everyone within 2 weeks of first referral. So you'll be assessed within 2 weeks, and then based on what your needs are, what you identify, urgency, your next appointment will be booked.
Great, thanks. How about you, Leanne?
Yeah, I'm the same because it's not an urgent service, so I tend to contact them within 2 weeks and see. Yeah.
Great. And Sahir, we know we've got a few more social prescribers, but I know referrals are coming through to you thick and fast, I'm sure.
I've currently got a 4-week waiting list, but that shouldn't turn anybody off from actually making a referral or making contact. you will be contacted. It's just the way the system's booked up at the moment, but people are more than welcome to get in touch. Sometimes it's just a telephone call that could just introduce you to the service, and then we can make a further booking for a face-to-face or a telephone assessment afterwards. But yeah, still very busy.
Yeah. Well, thank you, everyone, especially our speakers today, for coming and taking some time out of your schedules to share a bit more information about what you do. This webinar has been recorded, so we will distribute it more broadly to raise awareness. So thank you, everyone. Thanks for coming.
I'd just like to say before we leave, if you look on the chat, there's some email addresses to get in touch with us. I've also attached my walking group flyer as well, so please access, and if you're interested, turn up on the day.
Thank you, Shanaz. I will put those details with the recorded video as well.
Thank you.